In your morning medical news, a troubling new report from the Pentagon about military suicides. Military officials say 523 service members died by suicide last year. That's up from 493 in 2022. While the Army had the highest numbers, officials say preliminary data shows their rates are now dropping thanks to better gun and medication storage and new efforts to reduce stress. If you or a service member you know needs help, the Veterans Crisis Line is 1-800-273-8255. More and more American teens are feeling burnout and the need to achieve it all. According to a new report from Common Sense Media, more than a quarter of teens ages 13 to 17 feel this way due to the so-called grind culture. That is the pressure teens face to excel in academics, social life, and even how they look. 81% of them say they feel negative pressure in at least one area of their lives.
I think parents can really encourage a few things. One is sleep, protected bedtime. We need that.
Without phones.
Without phones. And giving your kid a hobby that has nothing to do with succeeding, right? That is not about putting it on social media. So finding and investing in a hobby for your child where there's a sense of mastery.
Experts also recommend parents encourage teens to get more face-to-face time with their friends, exercise, and spend more time in nature. Federal health officials are warning about an unusual uptick in a serious illness. More and more young children are getting knocked out by pneumonia. Jonah Kaplan reports.
When you've got young kids, it's always something. Daniel Chiat is a dad to 3 boys.
You go through all of the different ailments that it could be: flu, COVID, bacterial virus.
But pneumonia?
I had never really heard of kids getting pneumonia, so it just never really crossed our mind.
Why their middle son, Ruben, wouldn't stop coughing and why his fever kept coming back, questions the Chiats couldn't get out of their minds. Their pediatrician then suggested a chest x-ray, which found some fluid and inflammation in Ruben's lungs. A few weeks later, their son Perry got it too.
A little bit of relief when you get the diagnosis, because at least they were confident on what it was, but certainly scary too, because when you think pneumonia in adults, it can be a pretty serious thing.
That pneumonia is becoming so prevalent among youngsters, yes, physicians say that's serious. But this pneumonia isn't debilitating, which is why it's being called walking pneumonia. Dr. Melanie Lind Ayers is a pediatrician in St. Louis Park. She said her clinic has seen hundreds of cases this fall.
They're up at night coughing, they're not sleeping well, they're maybe having these fevers and they can't go to school. So overall quality of life is certainly affected, but it isn't necessarily translating into increased hospitalization.
So not too dangerous, but having an overtired kid isn't nothing.
I could talk all day about the importance of sleep on the brain functioning, mood, illness prevention, healthy bodies.
Parents should consider taking their kids to the doctor if their fever lasts more than 3 days and the cough gets worse after a week.